Welcome to AI for Founders. I'm Ryan Estes. What happens when you build an AI that can spot disease years before symptoms? That's the problem my guest today ran straight into. On this episode of AI for Founders, I'm talking with Mariano, four-time healthcare entrepreneur and CEO of Axenya. Axenya is an AI-powered operating system for corporate health that monitors over 100,000 people, runs around 95 million clinical inferences a month, and can intelligently route people to care across more than 40 conditions. If you're a founder building an AI, health tech, or any regulated, incentive-broken industry, this episode is for you. You're going to learn how Mariano redesigned his entire business model so someone actually had financial reason to pay for prevention, and how he thinks about AI as a copilot for doctors instead of replacement, and how he keeps his sanity and creativity through writing, photography, sports, and reading while running his fourth company. If you want conversations like this distilled into your founder-ready experiments every week, head to aiforfounders.co and subscribe to the newsletter. If you want the real stories and playbooks from people actually shipping AI products, not just tweeting about them, go to aiforfounders.co and subscribe to the newsletter. And is it tweeting anymore, or is it Xing? What are you doing over there? Anyway, and if you want to feel a little less alone building weird, ambitious things in public, you guessed it, newsletter at aiforfounders.co. And if this episode helps you, repay the favor by tapping 5 stars or dropping a short review in your podcast app so more founders can find this show. Now, a quick word from our sponsor, Kitcaster. If you're a founder, you already know the hardest part is not having something valuable to say, it is getting the right people to hear you say it. That's where Kitcaster comes in. Kitcaster is the agency I co-founded that books founders, experts, and executives on podcasts their buyers already listen to. Here's how it works. My team builds a custom interview roadmap around your story, then we line up interviews on targeted shows in your niche. Handle all the back and forth, and make sure you show up with angles that drive leads, hires, partnerships, or the next round. Our clients have landed on hundreds of top podcasts, generated millions in revenue, and turned a single interview into content for months. You do what you do best. Show up and talk about the thing you're obsessed with. We do the unsexy work of research, outreach, and scheduling so you can build authority at scale. If you're ready to turn conversations into pipeline, go to kitcaster.com, apply in a couple of minutes, and tell them you came from AI for Founders. That's Kitcaster by Moburst. All right, Mariano, welcome to the show. Thank you so much for joining me for this conversation.
Thank you so much for inviting me.
Absolutely my pleasure. I'm really looking forward to speaking with you because you seem to be a man on a mission and a man of principle. Not to mention you have beautiful photography, and hopefully we can get to that as well. But why don't you begin by giving us an introduction to your company and the customers you're serving with that company?
Sure. Axenya was born out of sheer curiosity, mostly. It was 5 years ago. I came from a series of other healthcare ventures, and I wanted to explore a little bit on where, the increasing amount of data that we were having and AI, which I think are the two things that are changing or revolutionizing healthcare these days. How that could be used. Remember, this is 5 years ago, so AI is not what it is today, and we had a little data, but not as much. And our logic was healthcare has been changing their targets for a few decades now. It was born in its modern form around 1940, and at that time, most of the issues had to do with acute diseases, with infections and things like that. And when you think about it, over the second half of the last century, we switch our focus to chronic diseases, which are quite different than acute diseases in the way they have to be treated. For one, they have almost no symptoms or very little symptoms up until it's very late. And remember, for the prior generation of diseases, symptoms are the one thing that takes you to the doctor. So when you're banking on that to take people to the doctor and you don't have symptoms, you have an issue there. And the other thing is that, treating chronic diseases just takes a lot of time, and you have to do many complex things and without much of a feedback system. So we were excited that you can do two things with data. You can collect it very continually. So you can understand, how your blood pressure works, not only at the doctor's office, but also when you're watching TV or playing with your kids or different activities during the day. And there's no reason why we cannot measure that in a more continuous matter. And then the other thing is we can examine data in much wider quantities than before. So you can get dozens and of data points, just put it on the web and analyze it every minute for every patient. So you have a chance of actually bringing patients to the doctor earlier, and that means that you're going to spend less and they're going to be better treated. And that's where we started. And basically, we found out that it was possible to monitor patients and intervene earlier. We actually took us about a year to do a big clinical study on that, and we proved that we could lower the effects of diabetes in your heart and in your brain and in overall death by 20% or something like that, and at the same time lower expenses. So that was kind of our start, and from there we put together a much larger models that now can identify something like 40 something different diseases and take you to the doctor before and help you understand where you have to go instead of bumping around in different doctors and things like that with intelligent navigation. And we are actually getting good results. And in a market that normally has a rate of increase of around 2.5 times the inflation, we are getting something close to inflation. It's still a little bit higher than inflation. Our target is to take it lower down to inflation, but it's a big saving, and we feel that it's going to have huge impact when this actually grows. It's already having some impact in Brazil, but this is a global problem.
Incredible. So Axenya is gathering data points from patients or from absolutely anybody. What data is it actually collecting?
It's mostly three types. We get financial data, which is the easiest to collect because we are plugged into the insurance system. So we know when you go to a doctor, we know you've been there basically because you've paid for the doctor. So we track the payment. Or we know that you bought something in the pharmacy, or you did some exam or whatever things they do that way. So that's kind of our backbone, because there you can have personal information. Then we have clinical information that we capture through different methods. Wearables is one thing, but wearables in Brazil, you have a penetration of around 15% of total population. So then we have other methods. We have a face scan that actually takes a picture with your own cell phone. You send us a picture, actually a video, 30-second video, and we can infer from there some 32 different clinical variables. And then we use basic questionnaires as of now. It have been used in medicine for years. So we gather other data types from there. Some patients share with us the results of their labs, and then we capture that as well. We capture data from labor health, which in Brazil is obligatory, is mandatory once a year. So we capture data from there as well. And we capture data from partners. So whenever we put together a system to cover a population, you always have like the big piece is the health plan, but then you also have small other partners that plug there, about an obesity program, for example, and then we capture data from them as well. And we have our own navigation nurses that cover something close to the 5% of the total population, which is the most critical 5%. And then for those people, we capture a little bit more, and everything goes together into a data lake.
Amazing. You're talking about so the financial information, you can keep track of people are on target with their renewal of their prescriptions. They're seeing their doctors.
Yeah.
You have clinical information, so you can kind of track like what diagnoses are, what treatments are, kind of keep track of that. And then there's a wearable component. When you mean wearable, are you talking like an Apple Watch or something like that?
So if you have an Apple Watch, we would plug to that. If you have any other wearables of that sort, we'll plug to those as well. Glucose monitors, things like that.
Glucose monitors. It could get your heart rate.
Yeah.
It could give blood oxygen content. You have all those data points.
If you have a wearable, we have a lot of data from you. But unfortunately, there's still things, particularly in a country like Brazil, where they are so somewhat expensive. So it's getting better, but penetration is still small.
They're expensive in the States too. It ain't cheap.
Well, they're going down in prices. They're going down in prices. Yeah. The most famous one are still in the hundreds of dollars, but you have some in the lower $40-$50.
This episode is brought to you by MoBurst, the AI-first growth engine trusted by iconic startups like Calm, Robinhood, Reddit, Uber, and Google. MoBurst is a digital full-service mobile-first marketing agency that helps companies to scale and become category leaders. Whether you're finding product market fit or ready to accelerate growth, MoBurst delivers creative, data-driven solutions that help with scale and efficiency and impact. At MoBurst, we're not just guessing what works, we're predicting it. As an AI-first agency, MoBurst uses cutting-edge tools to analyze user behavior, adapt creative in real time, and uncover hidden growth opportunities. The result, marketing that's faster, smarter, and built to convert. From early-stage startups to global brands, we've helped hundreds of companies overcome complex challenges, unlock new audiences, and optimize every metric that matters. At MoBurst, we believe that creative thinking, advanced technology, and data are the core drivers of success at scale. If you're serious about scaling your business with precision and purpose, it's time to talk to MoBurst. Visit moburst.com and let's build something category-defining together. Okay, I've got a confession. As a podcaster and founder, I'm constantly meeting incredible people, guests, listeners, or other entrepreneurs. But here's my little secret. I'm terrible at following up. My inbox is basically a graveyard of missed opportunities. Does that sound like you? You meet someone amazing, exchange emails, have great intentions, and then life happens. 6 months later, you're kicking yourself thinking, I should have stayed in touch with that person. This is exactly why I started using warmstart.ai. And honestly, it's transformed how I think about my network. Instead of letting relationships go cold, Warmstart analyzes my existing contacts and helps me identify who I should be reaching out to and why. It even writes the outreach messages for me. But here's the key. I review everything before it goes out. I'm not just talking about this because they're a sponsor. I'm talking about it because watching a healthcare executive use this to build his entire advisory board in one weekend with 4 CEO signups made me realize I was leaving money on the table every single day. Your network is your net worth, but only if you actually nurture it. Check out warmstart.ai, use code AIFF to get $50 off your first month. Stop letting your relationships turn into missed revenue. Yeah, this is something that I'm very, very curious about in regards to healthcare, is all these different biometrics, all these different ways we can assess symptoms, and I think where AI is particularly adept because it can process so much more data in parallel.
Yeah.
And what I'm curious about is because when I was a teenager, I worked at Whole Foods Market, which is like a grocery store or whatever.
Of course,
I was a produce guy, so I was the guy stacking up the carrots and apples. But in the natural living department is where they sold the vitamins and things like that. And there was a gal named Pammy. And Pammy was a naturopath doctor. She was a nutritionist and kind of a witch in the best possible way. And she was working basically semi-retirement at Whole Foods, selling vitamin C and echinacea, but people would come in, particularly people that are of like a natural bend, like they're not going to go see the doctor. So they'll like literally bring their cancer diagnosis into this case, Pammy. And she had this unbelievable knack of being able to treat the symptoms naturally for them. But what she used to say is like, I can smell it on them. I can smell the different disease or things like that. And it always struck me largely because she had like a devoted following of people that would come to her for medical advice. But it seems like we're getting closer and closer to that with these devices. So,
Yeah.
right now, I don't know if like wearables or phones can smell anything, but they can take a picture. I'm really curious about when somebody's using Xenia and they take a picture of their face, what is it measuring? What kind of feedback
Yeah.
is Xenia
So
getting?
so what we're using is a model that was developed by MIT. It's actually that what we do is that, and this is published science data. We are measuring the color of the blood vessels in your face, and that gives us an idea of glucose, gives us an idea of cholesterol and a bunch of other stuff, blood pressure as well, and things like that. None of that. It's supposed to replace a proper diagnosis. It's just it's just a guess. The way we look at it is it's a good guess that this is a person that should go to the doctor and check its blood pressure or whatever. And what we have, we use kind of layers, and I think your point is the one thing that's important. And it's so difficult to process the amount of data that we have today that unless we took approaches like these, we wouldn't be able to cover the whole population. And so, but you have to be careful. We're not making a diagnosis that the person has high blood pressure. What we're saying is the chances of this person having high blood pressure is average or more than average. And so we actually send those first to one of our nurses, and the nurses probably will send them to a doctor.
Incredible. I would be afraid that if I took a picture with Xenia, I would just immediately call like an ambulance.
No, we don't. It doesn't work that way. No, it doesn't work that way. The way. I mean, it would be fantastic if it could. I mean, some watches would do that, and the Whoop would do that if they detect an AFib, they would actually call an ambulance for you. It's not what we do is a little bit more long term. So we are measuring the trends and the chances of you having trouble in the future, and that's the most important part, because we want to capture you not when you're having a heart attack, but hopefully years before, so that we can do things to prevent that from happening.
100%. And the data points will keep emerging. There's a company called Canary Speech, and I spoke with the founders, friend of the show, and they're doing something similar, only it's all with voice. So what it does is it listens to you, and it can detect whether you have Alzheimer's or you have dementia. It basically is reading you from all these other data points. So we have voice input, we have photograph input. As you're looking into the future, what kind of biometrics and what kind of data would be kind of the holy grail, like for diagnosis, kind of from where we're standing right now?
It's difficult to say. I mean, they're attacking the problem from different angles. I'm biased. I believe that the holy grail is blood. That we are getting our chances of developing biomarkers in the blood, and there are many companies that are doing that in the U.S. already. Prices are still very high to deploy those on a population basis, but they're coming down. But I believe that with a few drops of blood, you can actually get a lot of biometric data, and from there very very accurate predictions on what's going to happen. I think that we are seeing those things. I think that Whoop actually is tying that up to their wearable. So you're going to have both the wearable and the biometrics to take care of that. So I think that's going to be the future. Now, Whoop is a very high-end, very expensive solution, and we need things that we can deploy to the whole population, but not only for the rich. But I think prices are coming down.
Yeah. Is there a little bit of cold feet as far as like single drop blood analysis after the whole Elizabeth Holmes debacle?
I think if you wanted to do exactly what she was doing, I think there would be. This is a different thing, though. What they are capturing is, and I didn't mean really naturally one blood drop of blood. It's a small amount of blood, but it's not one drop. However, there are companies that are trying it. They're trying to succeed where she failed. I actually saw a couple of companies trying to get data from a few drops of blood, literally.
Yeah. I mean, I have faith they'll figure it out, I mean, it's coming for sure. Now, as far as like, people that have acute pathology and, disease, this is a great product. What about folks that feel good, want to feel better? treatment for the healthy. Do you see like an
Yeah.
avenue there?
There's clearly it's not what we're focused. We are more focused on anticipating large problems in the population that would cost significant money. I think there is definitely a huge amount of people worried about living longer and living better those years. I think the market is very interesting. I think that unfortunately, as all new markets, I mean, there's a mix of things there. So there are more proven things and less proven things at this point. So it's a little bit of a mix at this point. But I think there is a very interesting market there. We all hooked to it in some way or one way or the other. I think is.
Yeah, it's definitely the future. When you're seeing like an evolution of the product where it becomes, let's say, like 100x better at diagnosing potential problems, how do you see like the role of your doctor kind of evolving if it's not necessarily doing all the prescriptive needs? I mean, we're not there yet, but what do you
Yeah.
think the role of the doctor will be in the future?
I don't see in the I don't know. It's very difficult to project 20 years out, right? But I don't think the next 10 years that doctors are going anywhere. I believe that they're getting much better in choosing the patients. I think that there is a big inefficiency in the way we choose patients today. And I mean, I'm pretty sure that you and I have gone to the doctor many times, and you wasted an hour of his time, and you left there very happy because you had nothing, and you're perfectly healthy. So that's an hour that he lost, looking for a patient that actually needs it. So finding the right person for the doctor is one thing that I actually see that we're getting better, and helping the doctor reach diagnosis quicker. It's also true. So we have, for example, a copilot for our nurses that actually allows them to treat patients, but I don't think that we will ever be able to replace them. I think people will not have the same engagement, and this could change, right? So many generations from now, what do we know what AIs can do? But at this point, I don't see that patients actually feel confident enough to be treated just by an AI. So the combination of an AI and a human is very, very powerful. But if you can save the time of that human for the real cases, and you save the time, that they spend asking questions or coming to a diagnosis that can be done much easier for a machine, I think that's a big improvement.
Yeah, agreed. I mean, you want to go get some blood work done, it takes a half day, you
Yeah,
know. And
yeah.
at least in the States, those gals that are drawing blood, not that friendly, you know, put it that way.
Well,
Um,
you can probably do that at home now, right? I think here, at least in Brazil, it's very common, and it's cheaper, funnily.
I don't know. I'll be a little intimidated. I'll have to look into it because if
Mm.
it'll save me a half day, I'm definitely
Yeah, yeah.
in the market.
You can probably do it in like 10 or 15 minutes, and they're very, very. I think, frankly, it's cheaper than actually going to the hospital.
Yeah. There seems to be a little bit of conflict as far as AI and medicine. The medical establishment in the States moves notoriously slow, and maybe for good reason.
Yeah,
But I've kind of heard that, like, as we're introducing, these new diagnostic tools that are there to aid doctors, we're adding new data points that doctors can actually assess. That, in fact, if they're getting all these data points, and let's say they miss the diagnosis, that they could actually be held financially liable. They could be sued if they missed the diagnosis based on all of the information they have. So now, if we're overwhelming doctors with too much data, they're almost like, hey, I don't want to look at all this, because if for some reason the AI does this or that, then I could be held liable.
yeah.
Like, how do we kind of overcome that, like, that tension, and just like the personal liability from the doctors?
I think it's an issue. I think that we have to have better models to do that. I think that the way we are approaching that as a copilot, where the doctor is the one taking the decision at the end of the day, and we're just giving them things that we saw. It's probably safer way, at least for now, of doing that. I think that the it's also very important that the systems are transparent. So one of the things that we put a lot of emphasis in doing is we think the model always tells us we think this, and this is the reason why we think that. And these are the papers that actually support my reasoning. And unless we can find that chain, we don't inform that to the doctor. So if you design it well and you put a doctor in the end, I don't think there is a reason for the doctors to be apprehensive of that. But if you go directly to the doctors, I don't think the models are that good yet. I think there is actually a study published 2 or 3 weeks ago by a team of Harvard and Stanford doctors, and they found that the rate of error in models, by medical models, it's still pretty high. Now we have to find a way of coping that, because the rate of actual medical mistakes is also high. Humans also make mistakes, so we need to get the best of both worlds at one point. We need to find a way of doing it. But I don't think it's irrational to be careful about it.
Yeah, 100%. Maybe talk a little bit about who your customer is, who you're selling to, and kind of where your market is. Are you guys in the States now?
We're not in the States yet. We are in Brazil only. It will take maybe a couple of years for us to go to the US still. Brazil is pretty large, and we want to make sure that we have a very robust product before we go there. Today, what we do, and this changes country by country, but the US and Brazil will work the same, is we actually take care of the insurance, or we are a TPA for the company. So what we do is we manage their insurance system, and we deploy the digital tools as pretty much as we see fit. We don't charge for the digital tools. What we charge is a fee if we actually lower their healthcare cost overall. So that way we feel that it's easier for them to understand what we're doing, and it's very important in healthcare to be aligned with your clients in terms of your revenue model. I think that one of the issues that we see in healthcare in general is that there is a lot of disconnects between the revenue model and what you actually have to deliver. And so, for example, if you go to a hospital, I mean, I'm not saying that they do this on purpose, but the more you spend there and the more they give you treatments for things that are irrelevant, the more money they make. I'm not saying that hospitals do that by any measure of imagination, but they're incentivized to do that. And that's
I'll say they do that.
Yeah.
Yeah, they're definitely incentivized.
Maybe some hospitals even do that, on purpose. Yeah.
Yeah, I mean, not to be pessimistic about it, but they definitely do. And that's
at least they don't avoid it because it's in their favor.
Yeah, 100%. So you're getting paid on the delta of saving with the technology. Technology is free, so you say, hey, let's audit on the back end quarterly, monthly, annually, and see what we saved, and then you get paid a percentage of that.
Exactly, and we do it on a yearly basis. And it's fairly easy to measure, because what we measure is how much did you get of an increase versus the market, and those are very easy to measure numbers. So it's very clear to see how much we have improved.
100%. And I believe in kind of researching for this conversation. You guys have raised $12 million to launch the product.
Well, we've raised more than that. We raised on Series A to $12 million in total. I think we've raised something like 20.
About 20. Okay, fantastic. And is that from state-bound VCs, or where kind of like your partnerships coming from?
We have VCs from everywhere. We have Brazilian VCs, and we have American VCs as well. We have Chilean VCs. We have an Argentinian partner as well. It's more of a global market.
Yeah. As I'm kind of getting ready for this conversation, I really appreciate founders like you, because you're very outspoken, and you're an author and a photographer. As I mentioned, you've had exits in the past. So first off, thank you for that. I want to mention your book, which is "Software is Eating the World, Yet Healthcare Remains Inedible." Yes. Talk to us a little bit about the book and kind of the reason you decided to pen it.
I think the main reason is that we have been talking about transforming healthcare with technology for a long time. I think that if you remember, I can't remember the year, it's more than a decade ago that Mark Andreessen wrote that famous software is eating the world memo for the Wall Street Journal. It's maybe 12 years ago. And if you go down 3 or 4 paragraphs in that memo, there is a sentence that says, "I believe that healthcare is next up for fundamental transformation." And 10 years later, it hasn't happened. And partially there is good reasons, as you said. The people are conservative in healthcare, so you don't want to do things that put people at risk. But I think partially is that issue of the huge amount of data and the fragmentation of that data and how you actually go through it. And so I believe that we have come to the point that we can do it. So, but because we have ability to capture that data and ability to process that data with AI. Just to give you a number there, I mean, we only have 100 and something thousand patients in Brazil. And for those, we do an average of 95 million clinical inferences each month. To be able to do that, with human-based doctors, it would take us a whole population of doctors in Brazil, and we probably won't be able to do it. So we now come to a point where we have the tools to do it. So I wanted to show a little bit of how can that be done. What are the things that prevent us from doing that, and what's our own experience in changing that? Because it's really I don't want to say revolutionary for my own company, but the impact is really big. Our clients on average are growing their expenses by half the rate of the rest. And you have to understand this is a market of about 10 trillion globally, and it's growing at 2.5 times the speed of inflation. So it's going to become unsustainable at one point. And we're closer to that point. Unless we change the way we look at healthcare, we are going to go broke. Most countries are not going to be able to pay for it.
So, yeah, and it's really, I mean, the business model is just fascinating and honestly kind of inspiring. I kind of don't like the fact that I am so cynical about the healthcare system in the States, because it seemed much more like a sick care system, and you have to be skeptical, and you have to kind of watch your back with the insurance companies. It seems like everyone's out to get you, and largely I think it's kind of what you were talking about, is that, the value chain is misincentivized, so the way you built that business model to basically be able to share in the success, on one hand, it's very inspirational, but don't you feel like it's kind of an unbelievable risk as well?
Well, we're very comfortable in the technology, and at this point, 95 of our clients actually are saving money, and that has been the truth for the past 3 years, which we have been marketing this system. So, no, frankly, I believe that it is the way that it should be done. I think that companies have to put their money where their mouth is. I think that it is so common for every other industry in the world. I mean, you don't expect that you're going back to a restaurant if they treat you badly, right? So it's the same thing here. I mean, at the end of the day, if they cannot keep you healthy, they shouldn't be making money because they're not adding value.
I mean, I love that, but you raised $20 million, and I'll read a quote that I really liked that you said, saying, "Have the definition of success is having impact on other people, building something that changes life, even if it's small scale. Success isn't how much money you make, because that's a trap." Now, how do you sell that to your venture friends?
It's not a phrase I say a lot to the venture capital community, to be completely honest. But
that's between us.
Between us and the 25,000 people that are looking at it. I actually believe that. I think that this is my fourth company, and I've been lucky in my life. I wouldn't need to do this for the money. And frankly, I don't tend to hire people that do this for the money. I think that the company has to be sustainable, but I think that there is a lot to say about having a purpose and wanna changing the world for the good. I believe in that as a way of improving our lives and the lives of people around us. But in any case, I also, even if you didn't believe in that, even if you didn't want this to do this for the good of it, I think that companies that sell technology, they have to be held accountable for that technology to work. I mean, you cannot get paid if you don't have an impact, and this is true in almost every industry out there except for healthcare.
Yeah.
And you have to be
100%.
reasonable on what you're asking the people to do, because we know that the state of the art is the state of the art, right? So
Yeah.
even if with the best doctor in the world, there will be people that get sick or get sicker after seeing them, and we have to be reasonable about that. We have to find good ways of measuring that. But the current way, which is pretty much, they have no responsibility on the outcome, I don't think it's good either.
That. What are some of the differences between, let's say, the Brazilian healthcare system and the American healthcare system?
The private system is very similar. The Brazilians have a universal health system as well, which it covers everyone, and it's not horrible in quality, but it's not the quality of what you would find in a private system in the U.S. So you have that advantage. Most people that can pay for it would actually buy private insurance, and that's about 30% of the population. Still a large number, given that Brazil is a large country, but it's about 30% of the total population. And those people will have a system that it's comparable to the U.S. in terms of quality and the kind of quality of doctors and things like that.
Yeah.
The universal healthcare is a little bit lower than that, but it's still not bad. It's still not bad.
Nice. I do feel bad bashing them all the time. Maybe I'm just spoiled because I feel like we do have pretty good high quality of healthcare, but boy, some of the bureaucracy is just really frustrating, But
I think primary care is a big issue. No, primary care is the issue in the U.S. The access to primary care is just too complex, right? It may take you 2 weeks to actually see a primary care doctor. So I think that's the main issue. When specialty care is pretty good in the U.S. I think it's primary care that actually lacks.
Yeah. A frustration too, while I'm airing grievances here, is some of the more preventative care, or just like kind of like health and prosperity kind of stuff, whether it's nutrition or diet or training or some of the other therapeutics, if you're talking about what's, kind of tip of the spear stuff, peptides, things like that, doing, massage therapy and chiropractic and acupuncture. I really kind of align with that kind of thing of like investing in wellness, as opposed to just straight healthcare. And it still seems like pretty divided, and I don't know if that's a product of like the education that they're getting or what, but that's an area I'm hoping technology will help bridge, which is to say that like, hey, maybe there's not clinical evidence that carrot juice makes you see better or something, but like we can see the benefits, broadly through kind of analysis of like wellness care.
I think there are two things there, right? So the first one is how you structure the contract you have with your insurance. So if your insurance contract is very short, which is the case mostly in everywhere, is you normally have an insurance that you buy for a year and then you have to renew it. And what happens there is biological processes are much longer than that. So if you have an insurance company that says, I'm only having this guy for about a year, will I want to invest in things that are preventative? And the answer is, in most cases, it's no. Because, I know that if I help you, lose weight or exercise more or things like that, everyone knows that you're going to be more healthy in the future. And everyone knows that you will spend less money. There's no discussion there. The point is, who is going to spend that money in the future with you? So if I spend money today to help you, lose weight, will I reap the benefits? And the answer in most cases is no. So I think that's part of it. The other part of it is, I think that, we've come to a point in the development of technology where we probably have the people have to take a little bit more care of themselves as well. It's a little bit. I read it somewhere. I hope. Well, I wish I could remember where, so I could give them credit. But the logic they said is, you don't expect your car insurance to pay for gas or for for air for your wheels or things like that. You pay for that yourself, right? And then if you have a major accident, then that's where the insurance comes in. But in health insurance, we expect that the health insurance pays for everything. There is no part of it that we actually contribute a portion of that. I think what we will see in the next coming years, it's the patients will have to get a portion of the bill as well, as we do in every other insurance. So I think those two things are the ones that actually prevent them from seeing these things with a better light. And then the whole thing, if you don't have perfect data for this or whatever, it becomes more of an excuse if you actually don't have the incentive to do it, right?
Yeah. I want an insurance provider that'll give me robot insurance, which is to say when my hand's giving me a hard time, they just hack it off and give me like a cool robot hand.
Yeah, I would love as well. Yeah.
That'd be great.
Yeah.
Mariano, you're a very creative person. You wrote a book. Your photography is gorgeous. You're out here doing interviews. Why is creativity important to you on your fourth company?
Yeah, I don't know. I think I never see this as connected. But someone asked me the question last week or so, and there are a few things that you just do because your brain needs it, right? So I'm not sure I would be able to be a decent entrepreneur if I didn't do those things. So there are the things that clear my brain for thinking broadly, and so I cannot put the finger on where exactly that helps me, but I think it creates space in your mind in a way. So I think I do those things more for that, more for the space in my mind than because there is a direct link of creativity and entrepreneurship.
Yeah, we have such a hustle culture. I don't think that gets mentioned enough. What else do you like to do to kind of create that freedom of mind?
Oh, but it's mostly sports, and I read a lot, and I write and photography. Yeah, that's pretty much it.
Nice. All right, it's that time in the podcast where we're going to hit the lightning round. Are you ready for this?
Yeah, absolutely.
Okay. You're obviously very bullish about AI and technology. Make the bear case. Where is AI not appropriate for the healthcare system?
Today, I believe it's not appropriate to treat patients directly. I think that it's very appropriate to be a right-hand system for the doctor. I don't think it's appropriate to treat patients directly for now.
Yep. If you were entering college today, knowing what you know, what would you study?
I think I'm suspicious to say, but I think the intersection of technology and healthcare is probably the most interesting area in the market for the coming years. So I would look at something like that.
Would you go computer science or would you go?
Knowing me, I would probably go computer science, but that's a personal preference.
Nice. This audience loves ideas, business ideas. If we're thinking about the kind of all the opportunity in healthcare and technology, what's a business idea that you have that maybe you haven't acted on yet?
Well, I believe there are two areas where there are inefficiencies in healthcare. One is the one that we are attacking. The other one is the relationship between payers and hospitals and places like that. Is very, very difficult for payers to audit hospitals and to understand that what they are being charged is the proper thing, and to understand the differences between the efficiency of one hospital and the other. I think that AI has a lot to offer there, and I think that's a very interesting area. We're not looking at that, but I think that's a very interesting area.
Would that be like kind of competitive analysis between hospitals?
Things like that, yeah. Fraud, things like 25% of healthcare expenses are fraud.
Yeah.
So it's
waste, fraud, and abuse.
Detected, yeah. Waste, abuse, fraud, yeah. Those things can easily be detected by AI.
Totally. Nice. Is there a CEO or entrepreneur that you closely follow or admire?
And everyone does Warren Buffett, right? I think that that's definitely one.
He knows how to pick a winner.
Yeah, yeah. No, I think the whole way he has lived his life up to now and the kind of lessons that he teaches on purpose and what to do with money and things like that. I think it's very relevant.
On a personal level, he seems to be a very humble man. He's
Yeah.
very, he's not even conservative. He's like frugal.
Yeah,
You
very
know.
frugal, very, very frugal. Yeah,
Yeah.
amazing.
What's something you know now that you wish you knew earlier?
I think that what I think that the thing I learned the most over my career is about how to manage people, how to be more patient with them, how to coach them into the team that you want to form. I think that at the very beginning I was very much about firing people and replacing them and doing things like that, and that's very tough on building a team. And I think that building a team over the long run, it's very, very important. And so I've learned to balance that a little bit.
There's kind of this sentiment of you hire slow, fire fast. Are you saying that like to kind of go
I
against that
would
intuition?
I would still hire slow. I think that I don't fire people as fast as before.
Yeah. Has that worked out? Have you found that people can be redirected and
I Well, it's interesting. I haven't found that people can be redirected that easily, but I think that the effect on the team it's worth it. So giving people chances of learning and things like that. Sometimes it doesn't work, but even if it doesn't work, the effect on the team on the whole overall feeling of the team, it's important.
yeah, I know what you mean. Um, what's unsettling to you about AI?
Well, it's a whole area we don't know much, right? So we all have this logic of I don't think that it's AI by itself, but it's the way we are governing AI, the way we are using data to train models and just taking data from people, without compensating them and things like that. I think that it's an area where we're gonna see a lot of wealth being concentrated, and I believe that's probably not good in the long run. And I think that AI has to be governed in a more pro society way. But
Mm.
it's very early. We'll see how it evolves.
Uh, Mariano, this has been fantastic. I really
Yeah.
appreciate your time.
Cool.
Your company, Axenya, which is AXENYA.com. People can check it out. Please keep us posted on how you're starting to move into the States. When you do move into the States, definitely hit me up. I want to help with that launch.
Thank you.
Really love hearing about the product and what the future of healthcare looks like. And I honestly, on a personal level, I really appreciate your approach. I feel like there's a massive overhaul of the healthcare system is underway. And I love hearing about people that are in it for the right reasons. I want everybody to be profitable, but I want, the success of everybody to be shared with the companies that are contributing to it. So thanks for that.
No, thank you. Thank you for inviting me. It was great.
My pleasure. Where's a good place where people can connect with you online?
LinkedIn has my profile. My email is there. Even my cell phone, I believe, is there. So it's very easy to get a hold of me.
Nice. All right. Well, I'm going to text you about getting some tickets down to Brazil.
Perfect.
Thanks so much for joining us.
Thank you very much.
Hey, founders, let me ask you this. Are you building with AI or getting left behind by it? If you're serious about scaling smarter, faster, and bolder, you need to check out aiforfounders.co. It's your go-to resource for cutting through the noise and actually using AI to grow your startup. Each week, AI for Founders drops a sharp, no-fluff newsletter, dives deep with expert guests on the podcast, and hosts monthly workshops where you can get your hands dirty with the real tools and strategies. Whether you're pre-seed or Series B and beyond, launching something new, or just staying sharp, AI for Founders gives you the edge you need to win in 2025 and beyond. Hit aiforfounders.co to subscribe to the newsletter, tune into the podcast, and grab your spot in the next workshop. And it's all free. Build smarter, move faster, think bolder with AI for Founders. Now back to the show.